Hello friends, in this video let's discuss about something very important now in the current situation. What are the available COVID vaccines in India and what is the role of vaccination in breastfeeding mothers? I am Dr. Aparna. I am a neonatologist at KIMS Cuddles, Kondapur, Hyderabad. So basically we know that there are two available vaccines in our country. One is Covishield, the other is Covaxin. Covishield is a viral vector vaccine, which means the viral particles of coronavirus are actually kind of loaded within another virus called as adenovirus, which acts as the carrier of some important viral particles into the body. And this is a very age-old technology which has also been used for some other vaccination. Covishield is primarily from the UK, from Oxford University, where it was primarily made by AstraZeneca, and in India it is being kind of distributed by the Serum Institute. So when we look at Covaxin, on the other hand, it is a completely killed or inactivated viral vaccine. This again is a very known technology when it comes to vaccine science. We have a lot of killed viral vaccines that we routinely use for children. Polio is a common example of this. So essentially, in order to say which vaccine is better, we really need to have head-to-head comparison studies. Head-to-head comparison means in a population of susceptible patients, if you give Covishield vaccine to one group and Covaxin vaccine to the other group and compare their effectiveness, then we get an answer to the question which vaccine is actually better. This kind of study is not available right now. So the available data is all kind of made from studies which have compared Covishield vaccine versus no vaccination and Covaxin vaccine versus no vaccination. As we already discussed, we don't have data from head-to-head comparison studies. Short of this, data about vaccination per se says that the vaccination efficacy, which means the ability of any vaccination to prevent symptomatic disease caused because of coronavirus, is between 78 to 81%. Which is fairly good efficacy, which means there is 80% protection when you give either of the two vaccines to an individual. So instead of getting into the debate of which vaccine is better, it is actually wise to go for either of the two available vaccines in India. With either of the two available vaccines, there are mild side effects reported, which include mild pain at the vaccination site, there can be headache, there can be vomiting, there can be a feeling of tiredness, muscle pain. Some individuals can experience some vomiting, diarrhea, there can be muscle cramps. There can be mild low-grade fever which can persist for 24 to 48 hours. Most of these complications or most of these side effects are mild and they may not seriously impact your functioning. Now there has been a worry about formation of blood clots or thrombosis with one of the two vaccination. Now when you look at detailed analysis of this kind of fear, it has been shown that the risk of this clot formation with the vaccination is no different from the baseline or the natural risk in the population. So it looks like either of the two vaccinations is fairly safe in most of the population, which means more than 18 years of age, and one can go for either of the two available vaccinations. Until recently, we did not have appropriate recommendations for vaccinating breastfeeding mothers and pregnant women. But recently, an Indian medical association called as FOXI, which is the Federation of Obstetricians and Gynecology Society of India, has actually gone ahead and given a recommendation that it is safe to vaccinate breastfeeding mothers as well as pregnant women with either of the two available vaccines in India. This means that if you are a breastfeeding mother or a pregnant lady, it is actually safe and effective for you to get vaccinated against COVID with either of the two available vaccination. When it comes to Covaxin, the manufacturers recommend that the gap must be 4 to 6 weeks. Now, when it comes to Covishield, which is a viral vector vaccine, as we already discussed, we initially started with a gap of 28 days. But the recent recommendations are the longer the gap, the better is the efficacy. So, if you give a shorter gap, say 4 weeks between 2 doses of Covishield, the vaccine efficacy may be slightly lesser than when you give a longer gap of 12 to 16 weeks between 2 doses of the vaccination. This is related to a concept called as immunological memory. So, the longer the gap between 2 doses of Covishield, the better is the efficacy. Efficacy after 2 doses of Covishield separated by at least 12 weeks gap has been found to be more than 81%. Yes, even if you have had COVID infection in the past, you still must get vaccination. This is because the duration of antibodies after recovering from natural COVID-19 infection is highly variable. So, it may be long lasting for somebody, it may be very short term for someone else, and there are people who have had a second attack of COVID disease. So, in order to prevent this, the gap after COVID-19 recovery must be at least 3 months before one goes for vaccination. Yes, still one must get vaccinated even after recovering from COVID, but the gap must be at least 3 months. The most important question in the mind of all of us is, does vaccination prevent an individual from developing severe form of COVID? That is, say COVID disease requiring ventilation, requiring ICU admission or leading to death? The answer is definitely yes. Both the vaccines are found to be almost 100% effective in preventing severe COVID infections and COVID related death. So, this probably is the most important reason why one should get vaccinated. So, there may be some of us who believe that we are reasonably immune to kind of withstand the effects of COVID infection, and we may think, why should we get vaccinated at all and even experience that small risk of adverse effects. Now, if you look at the concept of herd immunity, it means that only if the majority of the population either gets infection or gets vaccination, they would develop antibodies or immunity, and this only can stop the chain of transmission of the virus. So, even if it may look like it may not be necessary for you to get vaccinated for your own self, it may still be important as a responsible citizen for you to get vaccinated in order to break the chain of transmission, because you may actually be transmitting the virus to more vulnerable, more at-risk people around you. So, without hesitation, it is the duty of each and every one of us to get vaccinated with either of the available vaccination, and if it is Covishield, the gap must be 12 to 16 weeks, and if it's Covaxin, the gap must be 4 weeks. And this can be now safely recommended for pregnant women as well as for breastfeeding mothers. Thank you.